If you've been told you have an enlarged prostate and you're also noticing changes in the bedroom, you're probably wondering, are these two things connected? The short answer is yes, there is a real connection between having an enlarged prostate and erectile dysfunction or ED. Hi, my name is Dr. Gabal. I'm a board-certified urologist practicing in Southern California. Today, I want to walk you through exactly what that connection between ED and prostate enlargement looks like, why it happens, and what you should know about it. Let's start with the basics. An enlarged prostate, the medical term is benign prostatic hyperplasia or BPH, is extremely common in men as they get older. By age 60, about 50% of men have BPH, and by 85, that number rises to nearly 90%. BPH is a non-cancerous growth of the prostate gland that can squeeze the urethra and cause urinary symptoms. Things like getting up multiple times at night to urinate, a weak stream, difficulty starting, or feeling like your bladder never fully empties. Erectile dysfunction, or ED, is also very common with age. It's the inability to get or maintain an erection firm enough for sexual activity. About 40% of men have some degree of erectile dysfunction by age 40, and the prevalence increases by roughly 10% per decade, reaching nearly 70% by age 70. So now you may be thinking, well, if both increase with age, then they're both age-related, and that's why they show up together. Well, you're partially right. The relationship between ED and BPH is both confounded by age, but it's also genuinely linked through shared pathophysiology. This means that simply getting older is not the sole explanation for why these two show up together in many patients. Now, here's what a lot of men don't realize. Large studies involving tens of thousands of men across different countries have consistently shown that men with urinary symptoms from an enlarged prostate are significantly more likely to also have erectile dysfunction. And the more severe the urinary symptoms, the worse the ED problems tend to be. In fact, research shows that up to 94% of men with severe urinary symptoms also experience some degree of ED. So why does this happen? There's a few reasons, and they're actually quite fascinating from a medical standpoint. First, both conditions share a common underlying biology. The blood vessels and nerves that supply the prostate, bladder, and penis are all a part of the same pelvic network. When something goes wrong in that network, it can really affect all of these organs at the same time. One of the biggest factors is something called nitric oxide. Nitric oxide is a molecule your body produces that helps relax smooth muscle and opens up blood vessels. It's essential for getting an erection, but it also plays a role in how your bladder and prostate function. So when nitric oxide levels drop, which does happen more as we age, especially with conditions like high blood pressure, diabetes, or high cholesterol, both urinary symptoms and erectile problems can develop together. Second, there's a process called pelvic atherosclerosis. Just like the arteries in your heart can get clogged over time, the small arteries in your pelvis can too. So when blood flow to the prostate, bladder, and penis decreases, all three organs suffer. This is one reason why the same risk factors for heart disease, smoking, obesity, diabetes, high blood pressure are also risk factors for both an enlarged prostate and erectile dysfunction. And third, there's something called autonomic overactivity. Your nervous system has an automatic branch that controls things you don't think about, like heart rate and bladder function. When the system becomes overactive, it can increase tension in the prostate and bladder while also making it harder to achieve an erection. Now, here's something I think is really important for men to understand. Some of the medications used to treat an enlarged prostate can also affect sexual function. Medications called 5-alpha reductase inhibitors, like finasteride or dutasteride, work by shrinking the prostate over time, and they're very effective. But they can sometimes cause side effects like decreased sex drive, difficulty with erections, or changes in ejaculation that are really bothersome to the man. These side effects are not extremely common, but they do happen, and it's worth having that conversation with your doctor before starting the treatment. Alpha blockers, another very common class of medication for BPH, generally have less impact on erections, but can very often cause ejaculatory changes, particularly medications like tamsulosin or silodosin. Very commonly, they cause what's called retrograde ejaculation or backwards ejaculating, which medically is not an issue, but psychologically can bother some men, especially because it affects sexual pleasure. But here's the good news. There are treatment options that can actually help both conditions at the same time. A medication called tadalafil, which many people know as Cialis, was originally developed for erectile dysfunction, but it's now also approved to treat urinary symptoms from an enlarged prostate. It works by boosting blood flow and the nitric oxide pathway that we talked about earlier, relaxing smooth muscle in the prostate, bladder, and penis all at once. And so for many men dealing with both issues, this can be a real game changer. It can really be helpful. So what are the key takeaways here? An enlarged prostate and erectile dysfunction are not necessarily just two separate problems that happen to show up at the same age. They share real biological connections, reduced blood flow, lower nitric oxide, and nerve changes in the pelvis. So if you're experiencing urinary symptoms, it is very worthwhile to talk to your doctor about your sexual health as well, because the two are closely linked. And if you're already being treated for an enlarged prostate and you've noticed changes in your sexual function, don't just accept it as inevitable. There are options, and your doctor can help you find the right approach for your situation. As always, this video is meant to be educational and general in nature. Your specific situation really depends on your personal medical history, so please discuss any concerns with your own healthcare provider. What questions do you have about your health? Drop them in the comments below, and I will do my best to do a future educational video on it. If you found this helpful, please remember to hit like and subscribe, and I'll see you in the next video.